November is Diabetes Awareness Month, and joining us to talk about how to stay healthy to avoid developing type 2 diabetes is registered dietitian Barb Kaufmann. Good morning to you, Barb.
Good morning.
The main thing we think of is your diet with diabetes, and there have to be some lifestyle changes we must make to avoid developing them. What ingredients or what types of food should we really try to limit?
Well, I think the most important thing for management of diabetes in terms of diet is to focus on a healthy diet. People with diabetes don't necessarily have to eat any different than anyone else. Focusing on low-fat diet, watching your salt intake, managing your calories, and just a good variety of foods.
What are the risk factors of developing diabetes? Who does it usually target?
Well, there's a number of common risk factors. Age, over 45, are at higher risk. Certain ethnic groups are at higher risk. If you're at a higher weight, you're at a higher risk. Inactivity, high blood pressure, high cholesterol, all of those are contributory factors.
What are some of the symptoms that you might be experiencing if you have diabetes? And then to follow up with that, how do you get tested to see if this disease is something you have?
Well, the symptoms sometimes can be kind of hard to identify, but the more common symptoms might be increased fatigue, increased urination frequency, maybe wounds that don't heal are very common. Kinds of things that people experience. Many people don't have any symptoms, which is kind of difficult to identify, but the main thing about diagnosis is that you go into your physician and have a laboratory test, so it actually is a lab test. So often people want to use a friend or a neighbor's blood sugar monitor, but they really need to have it confirmed at the doctor's office.
And just how common is type 2 diabetes?
Well, diabetes itself, about 24 million people have diabetes in the U.S., and about 90% of that is type 2 diabetes.
How close do you think we are to having some form of a cure, or at least more manageable ways to keep it under control?
Diabetes is, there's so many new developments in the field of diabetes all the time, and they are working on cures. But there's always new medications to help us manage, and diabetes, that is probably one of the good things about diabetes is that it is very manageable. There's a lot of medications out there, and there are a lot of lifestyle plays a big part in managing diabetes.
All right, thank you so much for joining us this morning, Barb, for Diabetes Awareness Month.
Thank you for having me.